All right, so Sarah here. I'm going to be narrating our presentation on oxycontin and cancer. This presentation was put together by Kendra Gracie, Sarah Bella, and myself. So bear with me, and here goes nothing. What is oxycontin? So oxycontin is a narcotic, and it's derived by the opium poppy. It's semi-synthetic and was developed in 1995 for people needing around-the-clock pain relief. It has similar active ingredients as Percocet and Percodan, which we've kind of mentioned in our pharmacology class already, and has similar effects to morphine. Here we've also listed the chemical structure, but that's obviously not something we need to know, just kind of cool to see. Background of oxycontin. So, like we mentioned, it has derived from the opium poppy. 26.4 million to 36 million people are estimated to abuse opiates in the United States. Of that figure, 2.1 million people suffer from substance abuse related to prescription opioid pain relievers. According to Lemke, which I probably pronounced wrong, she stated that 60% of people that abuse opioids have received a physician's prescription either directly or indirectly. And so here we kind of see this connection of the actual prescription that's being given and then the abuse that's happening. And 60% of people start off with that prescription, whether that be directly or indirectly. Kind of mind-blowing. Characteristics of oxycontin. So it is itself a white odorless powder, dissolves in water, slightly soluble in alcohol, and it is a central nervous system depressant. It's an opiate agonist, so provides pain relief by acting on the opioid receptors in the spinal cord, brain, and tissues. How to take/use oxycontin. Typically, it's taken orally in tablet form. Each tablet has different levels of strength and color coded just for easy, identification. Those run from 10 milligrams up to 80 milligrams. Unlike prescription drugs, oxycontin can actually be taken with or without food every 12 hours. And it's a fast relief of pain. So within 2 to 4 hours of being orally administered, you should feel pain relief. And within 15 to 30 hours, pain relief effects are at like their optimal peak. If a patient forgets to take their dose, it's recommended as soon as they remember, they take it and continue with their pain management schedule, always leaving 4 hours between doses. But it's not recommended to double the dosage to make up for missed doses. So here you can kind of see where a misuse could easily happen. So it's not something you would ever want to do, is double that dose. Pharmacokinetics and pharmacodynamics. So pharmacokinetics, preferred route of administration would be orally. There are studies suggested that the rectal route of administration shows more significant results, and we will actually reference those. Pharmacodynamics, so in normal volunteer participants, researchers noticed that while on oxycontin, their pupils will constrict and sedation will occur. In cancer patients specifically, researchers found that they would experience analgesia, I don't say that word very well, and relaxation. How oxycontin helps cancer and patients. So, a study done by two names that I'm not going to try and pronounce investigated controlled release oxycontin use as a form of pain management with terminally ill cancer patients. They also found that the average dose of 78.6, so almost 79 milligrams a day for all of the patients, all 97 of them, were effective in relieving cancer-related pain. They concluded that high doses of oxycontin for these terminally ill cancer patients increased their quality of life and made their pain management safe and efficient. So it's really nice to see that it does have benefits and can really improve someone's quality of life. The dosage kind of shocked me when I first read it. I'm not sure how other people will feel, but with this next slide, we'll be able to see a different dose and a different administration. So as mentioned, Lee, I'm not going to say his last name, and Liu investigated the efficiency and results of administering OxyContin by rectal route rather than traditional oral route. They found that giving advanced cancer patients 10 milligrams every 12 hours, so a much smaller dose every 12 hours, provided adequate pain relief with minimal side effects when administered through the rectum. If the pain did not subside, the researchers increased the dosage of OxyContin in increments of 10 milligrams each time without exceeding over 150 milligrams per hour. My cats just went a little insane, so I'm really hoping that no one heard that. Side effects of OxyContin. So common side effects are as followed: drowsiness and sedation, dry mouth, gastral distress, so that would be like diarrhea or constipation, itching, rash, insomnia, confusion, chills, shortness of breath. So some uncommon side effects would be vertigo, which is like sensation of spinning or like loss of balance, mood swings, you might experience hallucinations like visual or auditory, pins and needles, amnesia, twitching or tremors, taste disturbances, pinpoint pupils, fluid retention, so like swelling in like your limbs, and blockage of bowels, as well as reduced sex drive. And here we go. So short and long-term side effects. Short-term would be sedation, sleepiness, lightheaded. They need to rub your face and nose, diarrhea, and suppressed breathing. Long-term would be addiction, death, constipation, itchiness, and suppressed breathing. When to stop using OxyContin and overdose symptoms. So these kind of overlap, and they are as follows. You would want to stop using OxyContin if any of the following occurred, and it could also be symptoms of an overdose. So if you experience shallow breathing, slow heartbeat, seizures, cold or clammy skin, confusion, severe weakness or dizziness, feeling faint, complete loss of consciousness, or coma. Here we have an overall diagram of what the side effects of OxyContin are. It says here oxycodone, those are interchangeable. The same thing. Unfortunately, this document came with it already labeled and we couldn't edit it. Addictive properties, so it is similar to heroin and can lead to just as many, if not more, negative outcomes. 5 milligrams of OxyContin has as much of an active ingredient as 1 Percocet. So there you kind of see the comparison between the two. People chewing or snorting 40 milligrams of OxyContin, here we've said oxy, but we're referencing OxyContin, is like taking 8 Percocet all at once, which is kind of mind-blowing. OxyContin is addictive, expensive, and when misused, can be lethal. So withdrawal symptoms are as follows. They can be worse as heroin and last much longer. So some of those would be like anxiety, a runny nose, or you could get like goosebumps. It could also be diarrhea, muscle and bone pain. We kind of go over why doctors feel compelled to prescribe OxyContin, and for this continued use, it is in relation to reducing the suffering of humans, and so they are prescribing it in the hopes to reduce pain relief, or to help with pain relief, sorry. OxyContin is prescribed to cancer patients in stage 4 as an alternative to morphine for pain management. different forms of cancer-related pain can benefit from pain management with the use of oxycontin, and those are lung cancer, Crohn's disease, a type of bone cancer that I can't pronounce, pancreatitis, and ulcerative colitis. Hopefully I've pronounced all those right. My apologies if I did not. So tolerance and physical dependence to oxycontin. Tolerance develops fairly quickly with oxycontin. So 10 milligram dose is the lowest dose, and a patient will quickly require a larger dose after they've built their tolerance. And it occurs with patients who use oxycontin as a part of their pain management, and they're no longer feeling the stages of side effects, and they will also not feel proper pain relief. So they then need to take more. Physical dependence develops when an individual is exposed to a drug at a higher dose over a longer period of time. And once an individual has become physically dependent on opioids, they will experience sickness once they discontinue immediately. Patients that are physically dependent on the immediate and fast effects of the drug can lead to a lack of motivation and determination to succeed in life after the high of oxycontin dissipates. So there you kind of see a physical dependence, and we kind of touch base on a psychological dependence in regards to the lack of motivation and determination. Precautions to taking oxycontin. So you need to make sure that you're aware of your allergies and you communicate with your doctor your medical history. We have the breakdown of tablets, which isn't important for us to know, but kind of neat to see here. Now we're going to go over the effects of opioid abuse in the brain. So we kind of talked about how oxycontin is an agonist. So I'm going to skip the first couple of points here, but it acts by attaching itself to the receptors within the nerve cells in the brain, which we kind of touch base on, as well as spinal cord and other organs. This can cause drowsiness, confusion, nausea, and constipation. The sense of well-being and pleasure is due to the effect of the reward region of the brain. Cautionary measures with oxycontin. So doctors need to dispense oxycontin. They need to take into consideration the following, and it's quite the list. I'm not going to read through everything, but that's kind of what they need to think about when prescribing this. So here we have overdose and deaths. You just kind of see how it steadily increases and then kind of plateaus 2012 to 2013, and we thought that was really interesting. Pediatric use of oxycontin. So the FDA actually approved the use of oxycontin for pain management in specific pediatric cancers. It's used for cancer pediatric patients, so that's 11 to 16 years old. Pediatric patients will receive their dose of oxycontin from their doctors, and the cancer patients were prescribed oxycontin when pain management would last a few weeks after spinal and birth defect surgeries, as well as significant trauma. And the minimum dosage received for this was 20 milligrams a day. Pediatric use of oxycontin continued. So according to Hertz, pediatric cancer patients will take 1 or 2 doses of oxycontin per day, rather than the adult pain management, which is like every 4 to 6 hours. So much lesser frequency there. When parents of pediatric cancer patients decided to discontinue the use of oxycontin pain management, the use of oxycontin pain management, they're recommended to slowly discontinue use to carefully avoid any withdrawal symptoms and stress to the patient. This is an interesting video that we don't have time to play, but check it out. Another interesting statistic, and my references. So we have made it through, and thank you for listening.